Let's get started. Welcome and thank you for joining us for today's electronic billing state level debrief for workers' compensation, an essential guide to the e-billing clearinghouse climate, including the New York State Workers' Compensation Board CMS-1500 initiative. Today's session is presented by Carisk Intelligent Clearinghouse in collaboration with the New York State Workers' Compensation Board. Before we begin the presentation, I'd like to just quickly go over some logistics. We ask that you please submit any questions you may have throughout the session using the chat feature here on GoToWebinar, and there's going to be 2 opportunities throughout the session to cover your questions. This webinar is being recorded, and we're going to post it to our Carisk Intelligent Clearinghouse blog and our YouTube channel for future reference. This presentation, along with additional resources, will be provided via email to all attendees following this session. And lastly, we'd like to ask that you please complete the post-webinar survey to provide us feedback on future topics. You're going to receive this survey via email following the presentation. And at this point, I'd like to pass it over to Sally to get us started.
Great. Thank you, Paige. Good afternoon, everyone. Included in our presentation today, we will be covering introduction of our presenters, along with coverage on the state mandates across the country, with a specific focus on the New York Workers' Compensation CMS-1500 initiative. After some additional information about Clearinghouse, we will have a Q&A with that section of the presentation specific to New York, and then we will follow up with some additional state mandate information for other states across the country that have been of interest to the attendee group. We'll follow with Clearinghouse services and then a final Q&A at the end of the presentation. Next slide, please. To start, I'd like to introduce the group to the presenters today. I am Sally Baglioni, and I've been with Carisk Partners for 3 years. I oversee the sales operation for the Clearinghouse division, and I am a liaison with clients to our internal stakeholders. I have 20 years experience in sales of product and software, customer service, and new business development. Prior to working at Carisk, I worked for several of the top publishing organizations in the country as a sales leader, and I have a master's in business administration from Monmouth University in New Jersey. Next, we'll have Vincina Annuzzi. Vincina has been with Carisk Partners for 9 years. In her current position, she is the Director of Implementation and Product Strategy. Vincina oversees the Clearinghouse operations, including implementation, development project, and customer service. She works extensively with key industry stakeholders, including our software vendors, providers, carriers, state insurance funds, and very specifically, the New York State Workers' Compensation Board. Finally, we are extremely fortunate to have Stephanie Zufali here with us today. Stephanie has over 28 years of experience in employee benefits, working for various New York State agencies, including the Workers' Compensation Board, the Department of Civil Service, and the Division of Budget. Currently, Stephanie is the Director of Regulatory Affairs and Risk Management for the New York State Workers' Compensation Board. And prior to New York State, she worked for 5 years as a certified public accountant for KPMG in government, banking, and manufacturing. Stephanie has a BS in accounting from the University of Vermont. So thank you all for participating in this presentation today. Next slide. To start, we'd like to just give a foundation of what the role of the Clearinghouse is in electronic billing. The Clearinghouse really is the intermediary between all of the submitters, no matter the type, providers, billers, hospitals, any software vendor, and we are in between the submitter and the receiver. And the receiver can be an insurance carrier, a state board for workers' compensation. The Clearinghouse is really the middleman to streamline the process so that the bills can be processed as quickly and cleanly from the submitter to the receiver. Our clearinghouse ingests the data in a variety of formats. Then we process it, scrub it clean, and translate it to whatever data format the receiver requires. And those requirements can change from payer to payer and from state of jurisdiction to state. A key component of what the clearinghouse handles in this process for workers' comp and auto is the attaching and exporting of supporting documentation with every bill that is processed through. Not the norm for other types of insurance billing, and certainly the complication for many of the clearinghouses out there who don't have that capability. Next slide, please. In the next section, we will jump into state mandates, and next slide page. Stephanie will give us an overview specific to New York. As many of you know, New York has an initiative coming due this July, and they are really spearheading the impact of a national adoption campaign for electronic billing in the workers' compensation area, which will be a help to everyone, both payers and submitters across the country. Stephanie?
Thank you, Sally. Welcome everyone, and thanks for joining us today for a presentation on New York State CMS 1500 initiative. My main focus today is to answer some of the most frequently asked questions that we've received, and also to leave you with some resources if you have additional questions. Next slide. Today's presentation will start with a brief overview of the CMS 1500. The CMS 1500 is already familiar to virtually all medical providers and insurance carriers. So the board anticipates a relatively smooth transition to the CMS 1500. This initiative will leverage use of both providers' medical billing software as well as payers' claims system, while promoting a more efficient workers' comp system. After the overview, we'll take a look at some of the questions that we've received about the CMS 1500. Next slide. So let's start with the transition to the Universal Billing Form, the CMS 1500. Next slide. The ultimate goal of the CMS 1500 initiative is to improve injured workers' access to timely, quality medical care by reducing administrative burdens for providers and encouraging participation in the workers' comp system. The board made the strategic decision to consolidate and eliminate certain medical billing forms and transition to using the CMS 1500 form. Most healthcare providers and payers are very familiar with this form since it has been used to bill Centers for Medicare and Medicaid Services as well as health insurers. Moving to the CMS 1500 billing form and standardizing possible objection reasons will make it easier for healthcare providers to participate in the workers' comp system and ultimately give injured workers more options for treatment. Now, let's review the timeline and answer some of the most frequently asked questions about the board's transition to the CMS 1500. Next slide. The CMS 1500 initiative will be rolled out in 3 phases. Phase 1 is the voluntary submission, which is the phase that we're currently in. During this phase, all board authorized providers may voluntarily transmit the CMS 1500 medical bills and required medical narratives or attachments as applicable through mail, email, web upload, and XML. However, it's recommended that it is done electronically through one of the approved XML submission partners, most commonly known as clearinghouses, such as Carisk. Payers should be accepting any type of CMS 1500 now, whether it arrives through a clearinghouse or through the mail. The board anticipates a mandatory implementation date of July 2021 for electronic submission of the CMS 1500. Phase 2 is the explanation of benefits transmittal, again in July 2021. Phase 2 will require payers to use specific claims adjustment reason codes, otherwise known as CARC, on their provider EOBs when objecting to payment of a medical bill. You can view these CARC codes by visiting our website at wcb.ny.gov and searching for CARC codes. During this phase, all payer objections must be filed at the same time on a C8.1B for legal objections or the C8.4 for valuation objections. New C8.1B and C8.4 forms with the corresponding CARC codes will be published in early 2021 so that payers have sufficient time to incorporate them into their claims processing system. Phase 3 is the mandatory submission of the CMS-1500, as I said, also in July 2021. Providers will be required to submit electronic CMS-1500 medical bills and the required narratives as applicable through their clearinghouse to workers' compensation payers and to receive EOBs back through their clearinghouse. The XML submission process will be the same as previously described in the first 2 phases. Based on regulatory feedback we've received to date, we do not expect to propose waiver criteria for either providers or payers. Next slide. We've received many questions from both providers and payers asking, what is an electronic CMS-1500? An electronic CMS-1500 is one that is received from an XML submission partner in an EDI or other agreed upon format. It is not a fax, an email, or a scanned document. Payers or third-party administrators must be able to receive the CMS-1500 and acknowledge receipt back to the XML submission partner. This acknowledgement date starts the clock ticking for the 45-day requirement to either pay or object to a bill. Next slide. So next we'll discuss the CMS-1500 requirements. I'll go over provider registration, CMS-1500 data requirements, medical narrative requirements, and then discuss EOBs and CARC codes. Next slide. For providers to successfully submit a CMS-1500 through a clearinghouse and onto the payer and the board, they must individually register for XML submission on the board's website. All treating providers within a group practice must register. To register for electronic submission of the CMS-1500, as well as to confirm whether you're already registered, please visit wcb.ny.gov and search Provider Registration XML. I'll show you this link now. So we're bringing up the web page, and you'll click on the listing of providers authorized to submit XML data. And this will pull up a Excel spreadsheet. So first, we'll want to check the listing of providers authorized to submit XML. The listing that you're looking at now is a listing of all authorized providers who have already signed an XML agreement with the board to electronically submit medical bills. The file is updated daily and includes provider name, license number, WCB authorization number, authorization status, NPI, and the board rating codes. There are currently over 9,500 providers listed. If a provider's name is not on the list, they should go back to the website and follow the instructions to register. The registration page will ask for the provider name, address, license number, NPI, and email address. Once that information has been completed, the provider will hit submit, and WCB, the board, will email an XML agreement to the email address that was supplied so that the provider may sign, notarize, and return the agreement back to the board. Payers and clearinghouses may want to be proactive to ensure that providers register prior to the 2021 mandate. Next slide. Both providers and payers may confirm which clearinghouses are approved to submit CMS 1500 to the board via XML. Clearinghouse status may be found by visiting wcb.ny.gov and typing list of XML submission partners into the search box. Currently, there are 4 approved, and actually there are now 9 organizations that are working their way through the testing process. Next slide. So now let's discuss the CMS 1500 data requirements. We have heard concerns from payers whether the CMS 1500 will contain all the data points necessary to accurately process a bill. We've published CMS 1500 instructions for providers, as well as other resources for providers and payers on the board's website. Let's take a look at the resources available on the board's website. PDF examples of the CMS 1500 by provider type can be found by visiting wcb.ny.gov and searching for CMS 1500 examples. We've included examples of the CMS 1500 for a physician, physician's assistant, nurse practitioner, DME vendor, psychologist, radiologist, and 2 examples of a physical therapist. On the same page, there's also sample forms showing how information from the current medical forms, primarily the C4 and the C4.2, transfer to the CMS 1500. And there is more information on medical narratives requirements, which I'll discuss next. So let's scroll back up and take a look at the CMS 1500 for an authorized physician. All the necessary data, including the carrier claim number in field 11B, the WCB case number in field 9A, and the date of injury in field 14 can be found on the CMS 1500. So let's go back to the PowerPoint. Additionally, there is a section of our website that includes frequently asked questions and news. This is updated regularly. Answers to questions raised during or after this presentation will be posted to the FAQ section of the board's website. And we're taking a look at that now. All right, if we could go back to the presentation, please, and next slide. So let's take a closer look at the CMS 1500 form. A key piece of data are the provider's WCB authorization number and rating code, which are reported in field 19, just shown by the horizontal arrow on the slide. Field 19 captures the WCB authorization number, followed by the rating code. Next is the type of attachment and an identifier number. And finally, the date the payer accepts the CMS 1500 is located in field 19. In this example, the acknowledgement date is March 2nd, 2020. It's the 8-digit date preceded by the code NTE add. This portion is added by the XML submission partner prior to sending it to the board. Again, this is the date that the clock starts ticking for the payer to timely pay or object to the bill. Other key data fields include the treating provider's National Provider Identifier, or NPI, in field 24J of the CMS 1500, and the electronic signature in field 31. These fields are shown by the vertical arrows on the slide. Next slide. The next step are medical narrative requirements. Next slide. So we've received a question frequently. Do all CMS 1500 submissions require a narrative or attachment? And the answer is yes. All CMS 1500 submissions require a medical narrative, or attachment, or else they will be rejected. At the beginning of a narrative, providers must include 3 mandatory elements that are unique to workers' compensation and are not otherwise found in the CMS 1500 data. These are causal relationship of the injury to the patient's work activities, temporary impairment percentage, and the patient's work status. Payers may object, and the board may determine that a medical bill is legally defective if this information is not included. Next slide. As I mentioned on the prior slide, there are 3 mandatory elements that are required on most narratives. This slide shows the requirements based on the provider type who rendered the medical services. As shown earlier, this chart may be found in the CMS 1500 Requirements section of the website. For most provider types, causal relationship, temporary impairment percentage, and work status are required with every bill. Causal relationship is not required if it's for a services performed by an acupuncturist, occupational therapist, physical therapist, or physician assistant. Similarly, these types of providers are not expected to opine on temporary impairment percentage. As I mentioned earlier, a medical narrative may be found legally defective if the required elements are missing. Next slide. So next up are EOBs and CARC codes. Next slide. Will the board require a standard set of codes for payers to use when objecting to a bill? The answer is yes. The board has published a standard set of claims adjustment reason codes, also known as CARC codes. It's expected that these codes will be required to be used on explanations of benefits sent to the provider effective July 1st, 2021, if a payer objects to a medical bill. There's one set of codes that all payers must use, instead of each payer having their own codes. So this should make it easier for providers to know why a submitted medical bill was not paid in full. Currently, providers learn of objections to medical bills through the C8.1 and the C8.4 forms. Use of these forms is expected to continue until the board's new onboard system is fully implemented in 2023. And as I mentioned in the timeline section of this presentation, new versions of the C8.1B and the C8.4 forms with the corresponding CARC codes will be published in early 2021. The next slide shows a crosswalk of the CARC codes and the C8.1B form. So today, a payer must submit a C8.1 and or a C8.4 to advise the board and the provider why they are objecting to payment of a medical bill. Starting in July 2021, the payer must list all objection reasons, both legal and valuation, on the explanation of benefit that's sent electronically to the provider. In this example, CARC Code 197 would be used when a payer objects to treatment that deviates from the medical treatment guidelines without securing a variance. Once payers and providers are accustomed to using the CARC codes on the EOBs, and the board is able to electronically capture the CARC code data directly from the payers through the IABC's state reporting, we plan to discontinue both the C8.1 and the C8.4 forms. In the interim, effective in July 2021, to object to payment of a medical bill, payers will need to send the board, as well as other required parties, the C8.1 and or the C8.4, as well as the EOB showing the CARC code sent to the provider. The objection reasons on the EOB should match up with the legal and valuation objections the payer sends on the C8.1 and the C8.4 forms. The board expects to issue guidance soon on optional use of a payer portal for providers to retrieve C8.1 and C8.4 forms in lieu of mailing them to the provider. Payers and medical bill reviewers should start working on mapping their adjustment codes to the CARC code set forth by the board so that they're ready when this becomes mandatory in July 2021. Next slide. A crosswalk of the current objection reasons on the C8.1 or the C8.4 to the new CARC codes, as well as the scenario when the code would be used, and any applicable law or regulation may be found on the board's website at wcb.ny.gov and search for CARC codes. We expect to publish one revision to the current CARC code listing on the board's website in the near future. This will be a unique code a payer may use to object to payment of a medical bill that was not sent electronically. We expect that the new CARC codes will make it easier for providers to understand any payer objections, and the resolution process will be quicker since all objections will be required to be sent up front. Next slide. There are a number of additional resources available to you on the CMS 1500 initiative. The first is our website, which again is wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all questions on the CMS 1500 initiative. The email address is cms1500@wcb.ny.gov. Next slide. To stay informed on these and other initiatives designed to make the board better for workers and better for business, you can subscribe to the board notifications straight to your inbox at wcb.ny.gov/notify. You can also visit wcb.ny.gov and select Get Notifications on the bottom of the homepage. You choose the topics you'd like to subscribe to. Next slide. Thank you for viewing this update on the CMS 1500 initiative. And again, please contact us if you have questions on these or any of the other New York State Workers' Compensation Board initiatives. Thank you. I'll now turn it back over to Vincinia to talk about Carisk's role.
Thank you, Stephanie. Now, these next few slides are going to give an overview of what's entailed in becoming an XML submission partner to the New York Work Comp Board. To start, legal agreements must be executed. Then all of the programming must be completed to translate bill data into XML format according to the board's specifications. In addition, programming must be completed to map the bill data as specified by the board onto an image of the 1500 form, as Stephanie had shown earlier. And the board is very specific about what data elements they want in which fields of the 1500, including non-standard data elements such as the Workers' Comp Board provider authorization number and rating code, and the Work Comp Board case number. Next slide. Then prospective partners must complete extensive multi-phase testing with the board prior to being an approved XML submission partner. Next slide. So the good news is that CIC has completed all necessary requirements and is already an approved XML submission partner to the board. CIC is handling the mapping of data behind the scenes so that submitting providers do not need to modify their current submission process. CIC will convert data to XML per the board specifications and transmit the data to the board while also converting bill data to whatever format the payer requires, whether that's X12, 837, or some other electronic format. Next slide. CIC is also able to accept EOB data from payers in any electronic format that the payer is able to provide, and we can then transmit that information to providers on behalf of the payer. And so, as Stephanie had noted, on the slide, we include the link that we strongly encourage all stakeholders, both providers and payers, to visit in order to subscribe to the Work Comp Board emails for regular updates regarding the resources also included in appendices to the presentation. Those include FAQs, requirements for payers and providers, board bulletins, future webinar schedules, and more. And next slide. With that, we are going to break now for questions regarding New York Work Comp Initiative, which can be submitted via the chat feature.
Thanks, Bea. I'll remind everyone to just submit your questions to the chat or questions feature. We have a couple questions right now for Stephanie and yourself. The first being, if a payer has no claim on record for a specific injury date, is it required to accept a CMS 1500 from an XML submission partner?
Thanks, Paige. I'll take that. So the answer is yes. Payer will need to accept the CMS 1500 from the XML submission partner, even if there is no first report of injury yet on file. There is a 7-day window between the time that the provider submits the bill and the time period where the clearinghouse is required to send us the file. So during that time period, there's a hope, at least, that a first report of injury could be filed so that it could match up to a claim before the 7-day period finishes up.
Thank you. Next question is, will all payers be required to accept the CMS 1500 electronically?
Yes, and the answer is yes to that as well. All payers are required to accept the CMS 1500 in paper form today, and they will be required to accept it electronically when it becomes mandatory in July 2021. Cannot stress enough that payers should be in the process of working with Clearinghouse to implement electronic acceptance of CMS 1500 or, through EDI, however you choose to receive that electronic data from the Clearinghouse.
Great, thank you. The next question is, what should a provider use in lieu of a claim number when submitting prior to the claim opening?
So if the claim has not been filed with the payer, so there's no first report of injury yet on file, then the claim number on the CMS 1500 is a situational field. So the case number should only be included if the claim has been assembled. So if it has not been assembled because a first report of injury has not yet been filed, then there's not an expectation that a case number would be included on the CMS 1500.
Thank you. The next question is, do providers choose which clearinghouse they get to use? What if a provider does not choose Carisk, but the payer does?
That's a good question. I can answer that, Stephanie.
Okay, thank you.
No problem. So from the clearinghouse perspective, the providers will want to choose a clearinghouse that is capable and an approved XML submission partner to the Workers' Comp Board. All the clearinghouses are going to be interconnected. So if a payer has chosen CIC as their clearinghouse partner, ultimately the provider's bills are going to get to that payer through CIC, regardless of what clearinghouse they choose to submit to. Ultimately, those bills are going to funnel through to CIC to get to the payer.
Thank you. Okay, next question is, as a third-party administrator who handles claims for self-insured employers and insurance carriers, will our information be captured anywhere on the CMS 1500?
Yes, so third-party administrator information will be captured on the CMS 1500 in item 0. This will include the payer name, address, city, state, and zip code. If known, the carrier W number should also be entered in item 0. Again, the carrier W number is a number that is issued by the board to both private insurer as well as self-insured employers. And if that W number is known, it should be included.
Okay, great. And then the last question for now is, what steps do I need to take now to be ready for phases 2 and 3 of the CMS 1500 initiative?
So payers should be working with an approved XML submission partner to ensure that they are ready to accept the electronic CMS 1500 submissions. Again, that can be in whatever format you agree to between the payer and the clearinghouse. If you want it to be EDI, that's great. Move forward with that. If there's some other type of electronic format that you have historically been using and you want to continue that and it contains all the data elements, you can continue with that. Payers should also be working with their medical bill reviewers to crosswalk the current objection reasons to the mandatory CARC and RARC codes that we have published on our website.
Okay, great. And then one more question. If the CMS 1500 form is completed to the Work Comp Board standards, will Carisk automatically kick it back to the providers, or do the payers still need to review and deny as defective?
I can answer that one, Stephanie. If the 1500 form passes all validations and meets all of the requirements, CIC is going to submit that 1500 to the payer. The payer is going to then provide an acknowledgement of receipt, whether it's accepted for initial processing or rejected outright for whatever reason. And then CIC will then turn that bill over to the workers' comp board. So we'll get the bill to the payer. The payer will send the acknowledgement of receipt back to CIC. We will then send that 1500 to the workers' compensation board. And the payer will still be required at that point to adjudicate the bill and provide downstream acceptance or denial of payment via EOB.
And Vincinia, I would add that, we on our end will be looking to make sure that the information on the CMS 1500 are valid CPT codes, that the provider NPI lines up with a provider who has submitted an agreement to electronically file. We'll make sure that everything is formatted correctly. The one thing that we are not going to be looking, though, as a validation edit is the contents of any type of medical narrative or attachment. We will be looking to make sure that there is something attached, but no validation edits of the content of the attachments.
And that's extremely similar to what CIC as a clearinghouse will be doing as well. We're going to have all of those validations up front. And just as Stephanie described, we do not validate the content of the narrative information, the supporting document.
Great, thank you. And that looks like that's all the questions for now. Just as a reminder, we'll have another slot at the end for any further questions. So if you have any questions throughout the rest of the session, please submit those in the chat or the questions pane. And now I'll pass it back to V to take us through the rest of the presentation.
Actually, I'm going to jump in, Paige. As you saw, as part of the New York section, we will continue to incorporate links for the state-specific information presented here. We also have on our website a state-by-state analysis of e-billing mandates that is under our current resources, and it is updated regularly. So if you have anything specific to a state that's not covered in this section, you can look to that resource for additional information. What's most concerning to most payers and providers is that the national regulations for electronic billing for work comp and auto at the state level continue to change. And because those requirements are changing, both the payers and the providers who provide services in those states have to adapt. The good news is that Carisk understands all of the national level requirements, and the Clearinghouse is equipped to receive and process the bills in the states of jurisdiction that you're working so that they are correctly processed with the highest level of success and efficiency. California, for example, is an optional state for electronic processing, but the payers are required to receive an electronic bill in the state of California. So if you do business there and would like to submit your bills electronically, you can, and the payers are required to accept them. Again, there's a link here for updates for the state of California that we would suggest you log into if you need more information. Next slide, page. In Florida, medical bills may be submitted electronically, so it's not a requirement, and the insurance carrier has to agree. We are finding that as New York moves forward, more and more states are adopting legislation in this area, and we are also integrating with large national payers. Probably to date, the largest carrier to note that we have a direct connection to is Geico for no fault in the state of Florida. And again, the links here for the state requirements. Next slide. In Illinois, again, it is an optional submission state, provided that the submitter is using the standardized form. And again, the link for the state of Illinois, should you need it. Next state is Colorado, and the division rules do not require electronic billing in Colorado, but they do allow for it when it is mutually agreed upon by the payer and the provider. Again, if you are in that state, the payer does have to agree to accept the bill electronically. Next slide. In New Jersey, New Jersey has recently gone through a mandate for electronic billing for both work comp and auto. This happened last fall. Receivers in New Jersey must acknowledge the receipt of that electronic bill, giving the provider or the submitter proof of acceptance for legal purposes. And to note, when these legislative bills became law last year, there was a large influx of submitters who wanted to be connected so that they could submit their bills and have them be compliant with the legislation, something we anticipate seeing in New York. So for anyone in that state of jurisdiction, we are recommending, integrating sooner than later. Waiting for that July 1 date could pose a problem just because we anticipate there will be a backlog come the spring and the summer. Next slide, please. In North Dakota, they too are initiating and will be implementing an EDI billing requirement that will be effective July 1 for any medical practice submitting greater than 50 bills per year. So more to come on that. We will be having a webinar specific to North Dakota after the first of the year for anyone who might be interested. Next slide. Minnesota is of importance to acknowledge, as they have been requiring electronic claim submission and transactions for eligibility for over 10 years. So, one of the states across the nation who really started in this category. And a few years after that, they did require an electronic acknowledgement. So they're a state where that electronic submission has been going on for a pretty long time. Next slide. Now on to Carisk capabilities. Next slide. Thank you. As Vincina mentioned, very important to make sure that you have an XML approved clearinghouse for submission of these bills in New York, which we are and have been approved, so that you can ensure that you get the most successful end-to-end error-proof submission and processing. We have the document capability portion of that. It can be done through your EDI file or within our portal. There's virtually no wait time for processing and no delays that you might see with some other systems with our system for direct connections to the largest payers in the nation. Next slide. Carisk Intelligent Clearinghouse has been processing electronic bills in the work comp and auto space for over 20 years. We were started by a physician who understood the importance of processing these bills electronically. We are the largest submitter of bills to the Work Comp Board in New York, and we have a flexible end-to-end platform that can be customized to any submitter's requirement. So it doesn't matter what software platform you're using for billing. And as Vincina mentioned, all of the required standards for the receivers and the states of jurisdiction that they work are built in so that we can ensure that your bills are processed through as successfully as possible. Next slide. Because of all of those interactions, we have a high level of success, and our tech-enabled solution is very simple to use. For those who need to have access to our portal, it's very user-friendly and allows for each biller to understand where their bills are in the process. What differentiates us from many of those out there is we do provide a high level of training for the user prior to them going live and submitting bills, and we have a manned help desk. So there is somebody during business hours who can answer the phone and answer your questions or problems as you're processing bills, so that your daily workflow is never interrupted as part of an electronic bill processing. Next slide, please. Because of all of the validations that are built in our system and the work that is done on the bill prior to it being submitted to the payer, we have a 97% first pass clean claim rate for error-proof submission. Our clearinghouse will alert the user or the biller if there is a problem with a bill. So we do not process anything through that we know for an obvious reason would be denied. The user is alerted that there's a bill that needs support or adjustments, and that user can go right into the system to make those adjustments and send them off to the payer. We offer claim verification within 24 hours and free storage of all the bills and medical records that are processed through our system. Next slide. It's very easy to be connected to our system, whether it be for a payer or a provider. There are few enrollment steps or an agreement for payers. Provider enrollment is simple. It's just a few pieces of information about the submitter. We have done and continue to do connectivity testing with files based on the software platforms, many of which have already been done. So it can be an easy call your software vendor and get connected, and then you can go live. So the 3 easy steps for both parties is really something that we pride ourselves on to ensure that as you transition from a paper process to an electronic process, we can make the time well spent and make it as easy for your team as possible. Next slide. If you'd like to learn more information or see a customized demo of our system and how it would integrate with your system, you can contact me at the information at the number provided or the email provided, and we would be happy to do a customized demo so that you and your team would understand how the relationship would work. Next, I'll hand it back to Paige for any final questions that there might be from the group. And thank you so much for attending our presentation today.
Thanks, Sally. First question is, do out of New York State providers have to submit their New York patients' bills electronically?
So we can't really regulate an out-of-state non-authorized provider, how they're going to submit the bill. But our guidance to them would be that the CMS-1500 is the prescribed form that should be used, and we encourage them to also sign up for electronic submission. So when you go onto our website to register for XML submission, you'll identify if you're an authorized provider in New York State, if you're an out-of-state provider, and I think there's 2 other different categories. So we can definitely accommodate, and we actually encourage all providers who are treating folks in the workers' comp system to register for the XML submission.
Great, thanks, Stephanie. The next question is, do electronic EOBs need to be sent directly to the provider, or can they be sent through a clearinghouse vendor partner?
So we have received clarification recently that the explanation of benefit, or I guess it might be the explanation of review, that is going to be considered the prescribed format of notifying the provider of the payer's action on the bill. And the current forms, the C8.1B and the C8.4, are additional information. So right now, it is the prescribed format, the EOB. It is supposed to go electronically to the provider. So yeah, that's the answer.
And Stephanie, the payer is able to provide that data electronically to a clearinghouse partner who can then disperse the data to the provider on behalf of the payer.
Yes, yes.
Great.
Okay, great. Okay, next is what is required in the supporting documentation?
So on our website, there are many examples of attachments that would be included in, depending on the type of services that are being performed. So for example, if it's a radiology bill, then we would have the radiology report attached. If it's a DME bill, then there would be the prescription order and, invoice attached. So, depending on the type of services that are being performed, we've given examples of what the contents of the attachment should include. And then as I went over in the narrative requirements, again, depending on what type of provider you are, that will indicate the extent of the medical narrative you should include. I did go over the 3 areas that are going to be required for most physician bills, and that's the temporary impairment percentage, the causal relationship, and work status. Those are really 3 key pieces that you're going to want to include in that medical narrative to make sure that the payers will consider that to be a complete bill, and it won't be found to be legally defective.
Okay, great. And then it looks like the last question is, does this initiative apply to me?
We really want to get the word out there that the initiative is going to apply to all provider types that are working in the New York State Workers' Comp system. So that's professional bills. So any type of providers that are performing professional services. The one area that it does not apply to would be facility bills. So a hospital, if they're billing, they're going to continue to bill on the UB04 or however it is that they're billing today. This is only going to impact the providers' professional component. But we do want to make sure that all payers are taking steps today to get ready for the electronic submissions so that they're prepared in July of 2021. And we are strongly encouraging all providers to go on to our website and sign up for the XML submission so that they are prepared and that they have started to get an arrangement with a approved clearinghouse so that they're ready to submit electronically in July 2021.
Okay, great, thank you. And that looks like that concludes all the questions for today. Okay, to wrap up, I will mention that if you'd like to sign up for future updates from Carisk, you can please email me, paige.krogan@cariskpartners.com, or visit our website. And again, your feedback is really important to us, so we ask that you please complete the post-meeting survey that you will receive within the next hour. Thank you again for attending our presentation, and we hope you have a great afternoon and a great holiday. Thank you.